Hi everyone, thanks for having me. Get to talk about a subject I love with the animal O&P. I feel like after the last 16 years we can write an atlas on it already, and I have 45 minutes, so you're going to get a high level view here. But these are some things I think are important to understand and recognize if you're going to get into animal O&P. And with that, I also want to give a few disclosures. I do own GoHeroGo.com and Wiggleless.com, which are different braces designs. And then we also have Hen Hat, which is a foot orthotic company, manufacturing company, which is where we make our money, I guess. So anyway, um, with that, let me pull up the presentation here and we'll get started. Make sure that everybody can see this and go to presenter mode. All right. So yeah, this is a quick overview. I'm going to go through prosthetics first, orthotics. We'll throw in a few cases, and then I'm going to talk a little bit about how veterinary O&P is a little bit different from an owner, vet, and animal standpoint, and how we're managing those considerations. And so here we go to. It's not giving my presentation yet. Oh, there we go. Okay, wrong button. So with this, we're going to start with prosthetics and kind of go over who's a candidate, some fitting issues we have, and then just a little fun that we've had playing with osteointegration. It's been a while since we've done this, but osteointegration was something that we played with early on, actually about when I first got started, about 14 or 15 years ago. The doctors that are doing that aren't around as much anymore. So human side's taking the lead on it now. But I can share a little bit of what we did on that. So who's the candidate? And in veterinary medicine, 99% of the amputations are full quarter amputations. So basically, like our hip or shoulder disarticulation. And so most of the dogs aren't even a candidate for prosthetic care, just because we don't have anything to hold on to, and training them to advance something with minimal leverage is near to impossible. So what we have to do is we have to coach the owners or the veterinarians on where we want these amputations a lot of times ahead of time. And so generally where that would happen is actually if the owner or the veterinarian contacted us first. So we're kind of the first line in being able to coach them on what they need to do. So a lot of what we want in the dogs is different than humans. First, we don't have the components that are the same, and we have some problems that we need, and I guess we have that in some of the other slides, that we would actually prefer disarticulations, because a lot of what we're doing is supracondylar type, or like a Symes where you're I guess it's still kind of supracondylar, supramalleolar suspension. So you're using the geometry. So with that, we like bulbous ends as well, because that geometry helps us hold it on a lot easier. Joe Linders tend to be contraindicated for mid shaft amputations, just because of the geometry, and when you shrink the cast to get the liner to fit properly, what it does is it kind of squeezes it off the end of the cone of the residual limb. We do have some fitting issues, and I guess these two are kind of tied together with why we are. I probably put this backwards and should have talked about suspension and some of these fitting issues first. So suspension is quite different in trying to fit an animal. Um, like I said, gel liners don't work. The fur is in between everything, and it complicates things. So it's if it makes it smooth enough that you can't hold on to the leg, then it will just slide off. The other side is some of the more coarse fur becomes an irritant and actually causes the skin breakdown. So it increases the friction that's going on in between. So with that, we have to look at different ways, and a lot of it's geometry based. So this is like a bent knee prosthesis of sorts, uh, that we made to. We can't functionally use the angle in this, but we use it for suspension and how we're holding it on. There's also no prosthetic component, so as you can see at the bottom of this, we actually just extend it like it's a brace type, and the dog has to learn how to use that extended extension um, when they're walking. So we have to work on fitting. Or see, I've gone through all these. Well, no, we missed chewing and weight shifting. So chewing, I mean, obviously with humans, we don't have to worry about somebody chewing on their prosthesis. But dogs, they don't understand why you've put this on their leg, and so a lot of times, if there is a fitting issue of sorts, they will chew at it, and it becomes a very expensive chew toy. So early on in the fitting process, we have to make sure that um, we don't have any fitting issues, and that we can work on some weight shifting so they understand what the prosthesis is for and how it's helping them. Uh, they learn pretty quickly to walk three-legged. I've even seen dogs walk with two legs quite effectively, and run. So their main function is to go. So um, the other big fitting issue that we have with dogs is bony prominences. So there's very minimal soft tissue from the knee or the elbow down in dogs. So bony prominences are everywhere, and there's little bumps here and there, and making accommodations for them can be quite tough. And what we do. So this picture that I have of this dog with the green feet, he doesn't have gangrene or anything, but this is to signify where you're good to go. So we really need to have enough length to be able to hold on to the leg. And length is actually more our friend, even so, than in human medicine. So, we may steer a person away from a Symes and do a B cage for prosthetic components that we can put in. But really, we just want as much length as we can possibly save, and really trying to focus on having a bulbous end in our fittings. So this green area, if they don't have at least down to this green area, they're likely not going to be a prosthetic candidate. And so it's just a kind of a good visualization for the veterinarian to understand how much they need to save. If not, it's they need to have a conversation with the owner, that likely they can't be a prosthetic candidate. So I talked about osteointegration for a second. So this is Triumph. I think this was about 2006 that we fit Triumph. Triumph was actually on Animal Planet. We had a little video. Well, I was in the surgical room, so you couldn't tell who I was, but it was a fun patient here, and he had bilateral osteointegration into the tibia, and he did really well for about 8 or 9 months, and then the stem started loosening up. So there's some things that are different in the osteointegration when we focus on the dog. So we have to go directly to weight bearing right away, just because the animal doesn't know any different, and we can't keep them from not non weight bearing. You can see these extensions that on this top picture. We actually started with just like stubbies to minimize the torques inside the bone, so we could get good ossification into the bone. Um, but really, the downfall of the whole problem was the skin. We had a geometry in the implant for the skin to grow into, and the skin never really took to that geometry. We do have some other ideas with actually turning on using proteins to turn on the actual cells. Um, Cells, proteins trigger the cells to do certain things, and there's actually a protein that will tell a cell to attach to something. The problem is that protein also tells um, the cells that we grow them in the petri dish for the cells to attach to the petri dish. So we've had some trouble harvesting that protein to be able to do it, but the intention is to actually trigger the skin to attach to the titanium so we can have that bacterial barrier. Um, like I said, there's not really any veterinarians in the world working on this project right now. So if you know of one, put them in touch with me, and we'd love to carry on with what we've learned and known. So that's all I have for prosthetics. Really, my primary focus has been orthotics. Early on, I did prosthetics. There's enough issues for me to not do that from a distance. I work mostly as a CFAB out here in rural Nebraska, so we focus on orthotics, which has a little bit more leeway for fitting issues. Prosthetics, generally, what I do is steer to the local prosthetist and help give some guidance from my prior knowledge of working with prosthetics. But prosthetics, it's just better to have your hands on the animal. And orthotics, like I say, we have a little bit more leeway to work from a distance. Um, we focus on 4 different designs for 4 different joints, I guess. Spine is a whole bunch of joints, but um, these are the braces that we focus on. There are a couple other braces. There's a hip brace and a shoulder brace that are found to be somewhat effective as well. Uh, I'll focus on these because this is what I know the best. Um, with a wrist, they call the carpus, which is our technical term as well, the carpus in the dogs. So often dogs will have carpal hyperextension, which their front end drops down. So we support those and lift them up. I have a case, I'll talk about that here shortly. And often they need to support an arthrodesis. So um, in veterinary medicine, we call an arthrodesis or I guess we call it an arthrodesis. In human medicine, we call it a fusion. So basically, an arthrodesis in a dog on their front end isn't. I mean, it isn't 100%. It's actually in a much lower percentage than that of the dogs that will be successful with it. So supporting the dog postoperatively is important. There's also been a study about talking about supporting the legs with varus and valgus deformities to get them back to agility trials. So those are the primary areas that we see the wrist and carpus brace in the dogs. If we go on back to their ankle, they call it the hock. Often they'll refer to the tarsus as well. These dogs, primarily what we're looking at is Achilles ruptures, or again supporting the arthrodeses. Uh, there is a disease in dogs called degenerative myelopathy, which is very similar to ALS in humans. So oftentimes, if we can catch the dog early enough on in the process, we will brace them to keep them more active for a while. But that's so much dependent on when the owner recognizes there's something going on and gets into the veterinarian. or they may recognize it, but they don't understand the extent of it and how quickly the dog is declining. Uh, they have a crouch gait often, which is kind of a neurological issue of we kind of have crouch gait in a sense in humans, but it's kind of coupled with knuckling, in which would be very similar to our drop foot. So we're just trying to lift that paw up so they're not scraping the top of the paw and have abrasions that can cause other issues for them. On the knee side, they call the knee the stifle, and they have a cranial cruciate instead of an anterior cruciate, and it tears. So that's what we've braced in this dog, and this is Robbie Porter. He's a vet tech down in Louisiana that loves showing off his rehab and what he can do, and he shared this. We have another video of a patient that he shot a video and what he did, and I'll share that with a minute. But with that, we try to support the ML support. So if there's medial-lateral inclusion, it's a lot harder to do that in the dog because of their adductors in the groin. They fluctuate in size so much to be able to do that. And some people will claim that you can support patella-luxation. The problem is in a dog, the patella, it's about the size of a pencil eraser. So we don't, it's really tough to be able to actually hold on to that externally. So I don't really believe that we can do much for patella luxation, and there are some other people that would disagree with me on that. We do spinal braces now. We just started wiggleless.com for that, and so with that, what we're trying to do is support that spine. Generally, the therapists want to keep the spine moving as much as they can, but with some intervertebral diseases that are way beyond what they can do muscle-wise strengthening, we do need to support the spine. And then again, with this degenerative myelopathy, the dogs, they need core support, and if we can provide this core support, they walk much better and can have an extended life. So that's generally what we're focusing on in the orthotics realm. Like I said, there is a hip brace. When I grew up, they always used to say that hip dislocations and hip disease was the major orthopedic case, and so it is harder to hold on to the hip in a dog, though, again because of what's going on in the groin and the adductors and whatnot. And then there's a lot of shoulder issues, and so that shoulder stabilization. But again, it gets to be harder to hold on, just similar as it is with humans. This is Robbie's case again. I just like this photo, but we're gonna talk about a couple of the different joints here, and I know I talk about this pretty quickly. I get pretty excited about it. So if you do have questions about anything I'm going through this, please put it in the chat window, and we'll have a little bit of time here at the end to be able to go over those questions with you. Okay. So this is Farley. This is a picture at Red Rocks in Denver, well, outside of Denver and Morrison. It's a beautiful amphitheater. If you had never been there, you should go. Everybody should go. It doesn't matter what kind of music you listen to. Find a concert there. But Farley had carpal hyperextension, and this is what I mean by hyperextension. So normally a dog's paw is straight when they pretty much from the elbow down. It's straight. There's a little bit of bend at the paw, but it's not supposed to bend right here. So this can happen from loss of, stretching of the ligaments, strength issues. There's some nutritional issues that go on with it, overweight, and those types of things. But sometimes what happens, we can support these and get them in the right position and take care of those other those other issues, and the joint tightens up. So what we did is we fit Farley with bilateral braces, and he kind of walks a little tin soldierish here. The owner thought it was pretty cute, uh, and this was kind of early on in his process, but he ended up wearing these braces for about 9 months and then started weaning out of them. And we were pretty pleased with what we got. So if you look here on the left, the left side is pretty much straight now, and the right side is, we're just missing a little bit in how much straighter that we would like to get it. But this is a very functional angle, and so we were very pleased with the outcome with Farley, and what all he was able to do and stay active. So this is Cami, and this is one of my favorite cases because I got to follow her for 2.5 years, and quite honestly, we didn't even know if she was going to last for 2.5 months. She had a soft tumor impingement on her spine, which was causing paralysis and neuropathies. So when we look at this video, we can see that she was having wounds because she was insensate, and she was dropping and knuckling, and she had pretty much all those things going on. And she was just trouble walking all around. And the owners, what they did is they actually went online and found a off-the-shelf brace, and this off-the-shelf brace has about 5 sizes, and it didn't fit. And so what they did is they started chopping things off of it, so they thought that it fit, but it ended up being just more cumbersome to her. You can see how she's panting. She doesn't want to walk. And this is at the same viewing as without her walking. You can see she's catching her toes. So what we did is we created a brace that looks kind of like a ground reaction AFO. So we're trying to lift that tibia up and open it up. And so this is the initial fitting, and you need to see this because this is what all dogs do when you put something on their legs. And I guess Carrie even said that on the video. I'll turn that volume down a little bit here. But here's 5 minutes later. So it's not perfect, but she's starting to figure it out. She's a little bit wobbly, but she's not falling down. She's protected. Her limbs are protected. And then here's a video. She came back. So like I said, I thought she was going to be gone in like 2 years, and with those wounds, she could have gone septic at any time. Which, so 2.5 years later, they come back and they say, "Listen, we have been going to the lake and playing in the sand, and we're wearing this brace out, and we want some new ones." And so this is the new ones. She's still pivoting some on the back, but she's walking around much better. Let me see if I can go back to that again. Walk, and she's staying so active. You can see that her body mass is filled out. She looks healthier. Just so many things. It's wonderful that she can have that extended life. So with Cami, the next case that we have is Morgan. So Morgan had an ACL tear, a CCL tear, and this is a case again by Robbie Porter, the guy that took the picture doing the yoga pose on the therapy balls. So Robbie likes to do video stuff, so he shot some, and he does tricks on the he has trick dogs doing frisbee dogs and dock diving and those types of things. So he likes to jazz this one up, but this is this is following her through the process. So she's not having surgery in this case. So she's an agility dog that he's trying to get back into shape. And oh, this is like a 44-second movie. So house arrest means they can't move around at the house. Not that the SWAT team came in to get them or anything. But he's working on lateral movements with her on this treadmill, going each directions. And then this is a weight shifting exercise. It has her walking backwards. So he's a little bit of a show off, but it's a really cool thing to show what can be done with the bracing as well. So it's kind of a stretch goal for the people out there. So those are the quick cases that I have. Um, we did have a spinal case that I would have loved to shown you, but the videos weren't converting properly. So we'll go on, and if you want to know about that, I can share those with you privately. Um, Now, for this next segment, I want to talk a little bit about the care with the different owners and with the different segments of what we're doing in the prosthetics and orthotics. It's different than human prosthetics and orthotics, and so often people, I talk to my old college classmates, and I'm from O&P school, and they're like, "Oh, that's so cool! You don't have to worry about insurance, and it's cash pay," and that's true, and that also leads to a different set of they're not problems, but they're things that you need considerations, and so we work with basically we have three different groups that we're concerned about. And in human we're worried about the patient and the doctor, but we have to throw in the owner as well in this situation. And so I kind of talk about this a little bit delicately, because they are passionate, and it's important that they're also paying for it. So it's important that you understand their role in what's going on. So owners have a zeal, but then this is also a traumatic situation. So when I grew up, I think we thought about our pets much differently. So I grew up on a farm, and often the time if a dog was injured, the answer was a 25-cent bullet, and it was not that it wasn't tough, but today that has turned into caring for the animals in a much different way. And and so with that, and the fact that insurance isn't involved, it's changed the dynamic. So I often explain to people that in human medicine, generally when we're deciding what's going on, we do surgery and physical therapy and a brace. And I'm stressing and because that's what changes when you look into veterinary medicine. Because insurance is not involved, those ands turn into ors. So you choose surgery or physical therapy or a brace or whatever other treatment modality. So with that, the mindset starts to change in what's going on with this. So um, oftentimes what we have to navigate is because someone's receiving a device, they think that like this is a pair of Dr. Scholl's that they got at Walmart, and if they didn't fit right or if they didn't help, I could just take them back and return them. And they don't understand the concept that this is a custom made device and we can't do that. So with it, there with these other elements going on, and understanding the situation. So they have this zeal for this dog. This is their child, and they want to help their child, and so um, that element is included in this conversations you have and trying to navigate how to do this. But what complicates it even more is because there's this is their child. This trauma, even though you and I know that it doesn't have to, it's not an emergent trauma, it is a trauma in their mind, and this is a very real. They're feeling these emotions, and so helping navigate them. It's very similar to when we're going to visit someone that may just had an amputation, and we know that we're not going to do a prosthetic fitting for 4 to 8 weeks. In their mind, this is a trauma. And they're going through all these different things. Some of them want to have something right away. So like some of them are trying to collect information, and some of them think that they're listening but aren't. So this is a very big communication area um, that we have. In a way, it's the patient because they're representing the patient, but it's important to understand um, and keep the owner involved and apprised of what's going on and the why of what you're doing. So in between that, the person that's also navigating that, this is this is the person that's also deciding what it's going to do, and it's also the person in the room that the owner is trusting, because this is the doctor that they've gone to with their animals for the last 10 years or however long. So these are veterinarians instead of uh, the vets that we work with. So these veterinarians have, this is the doctor in our case. So it's important to understand the background of where veterinary medicine is, because it's not in the same, it's not in the, it has a different perspective because there's different culture, the insurances and what can be paid for. Um, they have different not ideals. They all want to help, but just a different culture in general. So over the years, veterinarians in veterinary school have been taught a chance to cut is a chance to cure, which basically means I, I need to talk this owner into surgery because this is the best way that I can help this dog. And over the past 20 years, physical therapy and all these other holistic and integrative modalities have become more readily available through the internet. And so they are getting owners bringing them information from the internet that may not necessarily been taught in school or are just now being taught in school. So there is an apprehension about using bracing and physical therapy for that matter, for lots of different modalities, because it's just so easy to know that I can help this dog best if I can just have the opportunity to provide surgery. So that's one thing to understand when you're going into a conversation with the veterinarian. Another saying that's been through the years with veterinarians is three-legged dogs do just fine. And so we have a three-legged dog down here, and this is actually a two-legged dog. This in the wheelchair, the front wheelchair. This is a three-legged dog on Jack Russell using one of our braces. So the leg nearest to us is actually amputated. The brace is on the far side, and so I'm an amputee, and if somebody told me, you can do just fine that way, like I would say I want more than fine. And the thing is that owners are starting to press for more than fine now. Um, but we still have these full quarter amputations, so it's not matching up with how we can help. So Over the next 10 or 20 years, there still has to be lots and lots of education and getting veterinarians on board with understanding what we can do and how we can do it. So by me empowering you, you can help share those rules of thumb on our side that we need for where it can be, where we can be helpful. So in short, I guess it's still in its infancy with the veterinarians' involvement. You know, as far as research goes, there's one study for the carpus. There's not any studies, as far as I know, about prosthetics. We're working on a study for spinal. We're working on another study for the stifle. I think there's three. There might be four studies out for the stifle, but all in all, we're way in our infancy in this whole field, and having we know how hard it is in the human side to get clout, to get paid. And talking to the veterinarians, our clout level is much lower, and where we're at right now. And it's a part of the process, and it's a fun part, and I enjoy that, and that's part of why I'm here. Um, so that's what we have about the vets, and then finally to the animals. So animals have no words, so they uh, they speak to us in nonverbal communication, and the problem is that we don't always interpret that correctly, um, and when we're also trying to communicate with them, like we can't have a conversation and say, okay, now you have this prosthesis, you can put weight on it, swing now, or those types of things. So a lot of what we have to do is similar to like what might be going on in pediatric physical therapy, is a lot of play and just tricking the dogs into what they need to do. And so I put this respect slide in here. This is a much nicer picture than what I remember. Um, Early on in my career, I was doing a casting, and I ended up getting pinned into the corner, sitting on my rear, looking eye to eye with a Rottweiler that was very angry, and um, I was scared that I wasn't going to make it out, and obviously I'm here, so I did. Um, but it was it, there was a lot that went wrong in the whole situation. So basically, what was happening is I was casting their front leg, and I had the dog lying on its side, and I knew the dog was a bit cantankerous, um, and the owners did too, which was probably the worst part of it. I probably should have removed the owners from the room to help me. But one owner was sitting on a chair behind me, and the other owner was holding the dog's head down. And I repeatedly told the owner that you need to let the dog see me so he can understand what's going on. He was covering his head, and basically that we kept having that conversation, and the other owner was trying to console, and so she left from behind me and then went behind the dog and scratched its back. Well, the dog didn't know that anybody was over there, so in a fit of fury, he threw both owners off of him and pinned me into the corner. And fortunately, they talked him back. But we have to respect what what's going on with them. They're scared. They're going into a situation that they don't understand. They don't understand boundaries all the time. There's a level of pain. And then, like I was talking earlier, like how do you use these things? And so there, we have to we have to be able to communicate with animals and doing this. And each breed is a little bit differently. Each species is a little bit differently. We work with a flamingo at the Denver Zoo, and you know that that animal, fortunately, you could hold on to. But one of my um, cohorts or competitors. I don't know what you say. He's a friend. Derek, he went and helped an elephant in Cambodia, and I couldn't imagine working with an elephant and how I would be terrified in that situation. So, just respecting the animals and understanding how we can communicate. But that said, the reason I'm doing it is for the cuddles. I mean, there's the good side of all these animals, and they all do care. This is why we do it. And with that, I think that's my 30,000-foot view, and I'll take any questions. So thank you very much for having me.